Okay, we're going to talk about a whole bunch of stuff right now. We're going to talk about knee pain, groin pain, like if you have a chronic groin muscle pull, or if you have a chronic hammy pull, chronic calf pain, chronic heel pain. All that stuff is covered really quickly in this one assessment that we do all the time, many times a day at Blue Chip. So what it can start off with is, again, with sleeping with the right leg bent and this whole hip rotating back. So just kind of bend your knee up there. So what happens is this whole hip rotates back. The femur's not perfectly centered, so it will roll up and create what appears to be a shorter right leg. When you have that shorter right leg, this leg has further to come down to get to the ground once you get back upright. Get back here. So the correction means to, by definition, it involves a correction at the left SI joint, getting that rolling again. And this is just the start of it. At the femur and at the tibia, suppose you're standing like this. This would be your femur and this would be your tibia. What happens more often than not is the tibia will fall posteriorly in relation to the femur. That happens all the time. That's one of the most common causes for knee pain. Or it'll be rotated one way or another way. When that happens, that's going to put a whole bunch of strain on the capsule. So let's just pretend that I have this rotated. You can see just in my pant creases how that's going to put a lot of strain, if you can imagine the joint capsule, that way. Okay, so when that happens, that disengages the hamstring. When the hamstring is the hamstring will be disengaged in enough of a manner to keep you from, because it changes the leverage that your hamstrings pull with, you'll be disengaged there to keep you from actually pulling your hamstring, from getting a hamstring tear. Also, when that happens, your gastroc, which is your top calf muscle, the top calf muscle also crosses the knee joint. Your top calf muscle is going to have to pick up a lot of slack because the hamstrings are disengaged from a knee malposition. Also, when that happens, when the calf is overworked from having a malposition at your knee, which disengaged your hamstrings, which probably happened because you were sleeping with your right leg bent, you're going to get Achilles tendonitis because of the amount of overwork that's going to have to happen right here. You can get heel pain, calf pain, Achilles pain, and also the heel pain. So one of the great things about the chiropractic adjustment is it's like a reset button. When I can get things that are stuck here repositioned or remobilized, poof, it's gone. Just like that. It happens all the time in my office. I hope people who watch this video, who I've done this for, speak up. Also, when I can get the knee repositioned correctly from, say, here to here, not that bad. That's a dislocation. That's just so you can see what I'm talking about. But say suddenly from here to here, then you re-engage here. The hamstrings tether up into the hips. So if the hamstrings are disengaged, you're going to be that much more unstable. So making this correction increases the stability at your low back. You with me with all this? So the correction for low back pain, hip pain, knee pain, calf pain, Achilles pain, foot pain, any one of those is to correct the foot, the ankle, the heel, the calf, the knee, the hamstrings, the low back, the left SI joint especially, and at the pubic bone. These all have to, this has to be done in order for the work to be complete. If you don't get all of this at once, this is going to take a lot longer than it should.